Time now for our Broward Health Injury Report with Dr. Kurland. This week we're going to talk about meniscus injuries, an injury to the knee. And doctor, maybe break down a little bit what a meniscus injury is.
Well, the meniscus is a C-shaped cartilage that's in the knee. There's one on the inside, the medial meniscus, and one on the outside, that's the lateral meniscus. And they serve as buffers or shock absorbers in the knee, and they help prevent future problems in the knee, such as arthritis. So it's a very important structure.
And with a meniscus injury, then what happens? Is surgery required?
Well, meniscal injuries, sometimes if they're partial tears, can be treated conservatively with the standard rest, ice, compression, and elevation. But when you have a tear, if it's in the vascular zone, we generally can repair those, and we try to do that especially in the younger patients. If it's not in the vascular zone and there's an unstable portion of meniscus, we do debride it and remove that portion so that the patient will be stable and hopefully avoid future problems.
And what kind of rehab are they looking at?
Well, after surgery, if they do have surgery, they would undergo electrical stimulation, ice, warmth, ultrasound, and exercises, especially isometric and chain reaction exercises.
Very good. Doctor, thank you so much for joining us. We really appreciate it.
You're very welcome. Thank you for having me.